So, a common question many may have is how do I know if I started perimenopause? Like, what symptoms am I going to have? So, perimenopause is that period before we go into menopause. Menopause is the cessation of your cycle, and it's one full year without a menstrual cycle. From a chemistry range, we will see an increase in FSH and LH with a lady who has ceased her menstrual cycle. We can also see decreases or basically almost non existent levels of hormones such as estradiol, progesterone, declines in testosterone. But how does a lady know if she is in perimenopause and when does that usually start? So, perimenopause can start as early as our mid 30s and extend into our 40s. But usually, when you start to get around the age of 40, 45, you probably are experiencing symptoms of menopause or perimenopause, excuse me. So those symptoms can look different for every woman. They can include things as hot flashes. So you may start to have hot flashes, night sweats. You may have changes in your mood. Maybe you become more irritable for things that just didn't used to bother you. Some ladies, the biggest clue is a change in their menstrual cycle. So some ladies will say they were very regular. Every 28 days, they were having their menstrual cycle. And now, not so much. Maybe it's extending out a little bit longer. Maybe it's a little bit shorter. Maybe they're seeing their cycles are a lot more heavy than they used to be. Some ladies can definitely have issues with libido, so they no longer want to engage in sexual intimacy with their husband. Maybe they have vaginal dryness. Some ladies can definitely even see things like bloating and gut changes. Maybe you're starting to become constipated and not having a bowel movement on a regular basis, which for me would be every day. If you're not having a bowel movement every day, you have issues, you're constipated. I just want to put that out there. But those can be some symptoms of perimenopause. Um, we actually start to have a decline, a sharp decline in progesterone around our mid 30s. And so, again, one thing people may see or notice is that they just don't sleep as well as they used to. And that's because of that decline in progesterone. With perimenopause, it can be anywhere between 5 to 10 years before your cycle actually stops. Everyone is different. Sometimes it depends on what your mom and other ladies they dealt with themselves before they went into menopause. That can give you a good idea of when you may go. Unfortunately, we are exposed to so many types of endocrine disruptors that many women are finding themselves going into perimenopause a lot earlier than they used to. But everything is not perimenopause, right? So I would say, as a woman, if you have regular cycles and then all of a sudden you're not having a cycle, you need to check and make sure that you're not pregnant because that could be a possibility. And that actually has happened a lot in ladies in perimenopause because their cycles have changed so much. They assume that, maybe I'm just going a month or two without my cycle and they're pregnant. So that could be a possibility. Thyroid issues, especially hypothyroidism, could be an issue. Are you anemic? Do you have issues with polycystic ovarian syndrome? Even though usually that's something that we see in younger women, it could be present in older women and you just weren't diagnosed properly. So you definitely need to have the conversation and see someone who knows how to evaluate you properly and consider all the things before we just say it's perimenopause, right? Now, if you're in perimenopause, again, the issue that we see is this wild fluctuation in the main estrogen, which is called estradiol. And because of this fluctuation, again, changes in cycle, changes in mood, irritability. It can affect our sleep. We may even see things like our blood pressure go up or our cholesterol numbers go up because estrogen is important for that. So this is it's a time of great flux, but you can get through it. if you find a provider that will help you to walk through it properly. So, for a patient that comes to me and I am concerned that they may be in perimenopause, I do check labs, but I don't only go by labs, I also go by their symptoms. So, labs include hormone panel, it includes thyroid panel, again, making sure you're not anemic, looking at nutrients such as vitamin D and magnesium, a 4-point cortisol saliva panel. If we need to do some comprehensive stool analysis because you're having a lot of bloating or constipation, diarrhea, alterations or alternations between those, we do that as well. So it just depends on what it is that you are looking for and how quickly you're trying to get there. And I do put women on bioidentical hormones if they are in perimenopause. Usually, progesterone, like I said, can start to decline as early as our 30s. So we're doing progesterone, whether cream or a pill, depending on your symptoms. Testosterone may be declining as well. It does not drop as quickly as progesterone does. It's more of a gradual decline, but testosterone is important for us, especially when it comes to just overall health, having the energy we need, building muscle. It's very important for our vaginal health and decreasing things like vaginal dryness, urinary tract infections. It's important for libido. Our heart actually has the most receptors on it for testosterone, so it's a good hormone to use overall. And then some ladies, especially if they're pretty aware of their cycles, know when their cycle is going to come on, I do use bioidentical estradiol for them, whether it is the patch or we can do creams. So there's several different options that can be done for the lady that thinks she is in perimenopause. And so if that is you, if you are waking up exhausted, you're tired, you are gaining weight, especially around the midsection and the hips that you never used to, despite the fact that you are doing the things, you are eating well, you are exercising, and you're noticing that this just isn't working well for me anymore, you could be in perimenopause, and I would love to talk to you. So I have a free discovery call that I offer to anyone that is interested in learning more about my practice and seeing if I'm the right fit for them and if I can help them. I also have a guide. It's called Is This One Thing? It kind of helps to put into a better frame. One of the things in conventional medicine, we go to see so many doctors for this, for that. And it helps you to see, is this sleeplessness that I'm experiencing? Is this fluctuation in my periods, this irritability, mood change? Could it be related to a essential issue that I have not really thought of or my clinicians have not really thought of? So that is yours free. You can download it, fill it out, um, and just utilize it to help you to kind of figure out what's going on with me. And again, if you want to book that free discovery call, I would love to speak to you. So I am Stasha Gay Roberts, nurse practitioner, founder of Compassion Primary Care. I am BHRT certified and I am a US Army veteran. And so I like to say that this is not your 20s or your 30s, but this does not have to be your new normal. And you do not have to prove that you are struggling to be taken seriously here. Again, thank you for taking the time to watch this video. And I look forward to assisting you in nursing your journey to lasting wellness. Take care. Bye bye.